How to examine the respiratory system. Yes, what are the complaints? Cough, okay. Chest pain. Anything else? Inability or breathlessness. Okay. Anything else? Difficulty in breathing. Okay. Anything else? Chest pain. Fever. If there is a pneumonia, bronchitis, tuberculosis. So chest pain, fever, cough with expectoration or without expectoration. That is sputum. With expectoration, that is cough with sputum or dry cough. No expectoration. Then bluish discoloration of the nail skin. That is cyanosis. Clubbing, swelling of the tips of the nail or the nail base. Patient don't know the term clubbing. On examination, we can detect the clubbing. So patient's complaints are the chest pain, fevers, cough may be dry or with productive cough, that is the expectoration, breathlessness, and bluish discoloration of the skin, that is cyanosis, and sign that is the clubbing. So these are the complaints for the respiratory system. Again, we examine the respiratory system under two headings: general examination and the systemic examination. First, we will see the general examination. In general exam, again our first point is the build. So, build of the patient. Again, it is the average skeletal structure, proportion of the height and the weight. Second is the nourishment. So, here the nourishment, that is a muscular structure, normal, obese or thin. Suppose the patient is of the tuberculosis. His nourishment will be normal or is thin, weight loss. There is a weight loss in the chronic conditions, any illness which is for many days or for a chronic illness, there is a weight loss. So in also tuberculosis, there is the weight loss. So second point is the nourishment. Build, nourishment, then cyanosis, that is bluish discoloration of the skin. Because it is a respiratory disease, we are examining the respiratory system. In the respiratory disease, because of the decreased oxygen carrying O2, there is a cyanosis. So that is the bluish discoloration of the skin. Then next is the clubbing. Last practical in the cardiovascular examination also is study what is the clubbing. So that is the bulbous enlargement of the nail beds, and it is examined by the, what is the name of this test? What is the name? What is the name of the scientist? Charmat's window test. This is the Charmat's window test. There is a normally there is a diamond shaped window is present. In normal person, there is a diamond shaped window is present. But in cases of the clubbing present in the congenital heart diseases or the respiratory diseases, there is a clubbing is present. The window is absent. That time you say Charmat's test window test is the positive. So this is the clubbing, and then next is the neck lens. Examination of the neck lens. Distended or not normal. This is also done in the cardiovascular system. Examination of the neck lens. Then next is the accessory muscles of the respiration. So which are the main muscles of the respiration? Which are the accessory muscles of the respiration? Yes? Which are the muscles for the inspiration? Diaphragm and external intercostal muscles. Muscles for the respiration, diaphragm and the external intercostal muscles. Muscles of the expiration, passive relaxation of the inspiratory muscles. Passive relaxation of the inspiratory, this is diaphragm and the external intercostal muscles. Which are the accessory muscles for the inspiration? Scalenus, okay. Then sternocleidomastoid muscle, okay. Then serratus anterior, alignment. So if these muscles are working, accessory muscles, that is the sternocleidomastoid muscle, serratus anterior, alignment, that time patient is breathless. Then if you are observing and these muscles are working, there is a working of the sternocleidomastoid muscles, there is a working of the alignment muscles, that is the nature muscle. That time the patient is breathless. So observe these accessory muscles are working or not. Then next is the lymph nodes. Examination of the lymph nodes. In chronic inflammatory conditions, the lymph nodes are enlarged. Why are they? So, in the, can I repeat general examination again? So, last is the examination of the lymph nodes. Suppose patient is a non-case of tuberculosis. Lymph nodes are enlarged. Cervical lymph nodes are enlarged. Axillary lymph nodes are enlarged. So, examination of the lymph nodes. In any infectious diseases, there is the lymph nodes also get infected and there is an enlargement of the lymph nodes. So, examination of the lymph nodes. So, general examination, build, nourishment, cyanosis, that is a blood discoloration, clubbing, Schwann's window test, neck veins distended or the not distended, accessory muscles of the respiration are working or not working, and last is the enlargement of the lymph nodes. Lymph nodes are normal, their size is increased. So this is the general examination. Then we go for the systemic examination. Again, systemic examination is under the 4 headings: inspection, palpation, percussion, and auscultation. 4. Respiratory system, there are so many questions and so many points are there, more than the cardiovascular system. So, second is the systemic examination. In systemic examination, first one is the inspection. First is the inspection. So in inspection, size and shape. What to inspect? One is the size and shape of the chest. Size and shape. Examine or observe size and shape of the chest. Normally, chest is a bilaterally symmetrical. Normally, chest is a bilaterally symmetrical. If there is a change in the size and shape, it is a asymmetrical, or there is any disease condition which causes there is a asymmetry of the chest. Normally, it is a bilaterally symmetrical. For that, you have to examine the transverse diameter and the epidiameter. You have to examine the transverse diameter. That is from the right side, from the left side to the right side. This is the transverse diameter. Epidiameter, anterior and the posterior diameter. Normally, transverse diameter is more than the epidiameter. Transverse diameter is more than the epidiameter. If you take the cross section of the chest, it is an elliptical shape. That is, a transverse diameter is more than the epidiameter. But in If there is asymmetry of the chest or any disease is there, if this elliptical shape is not there. Suppose pigeon chest, that is in the rickets. Pigeon chest in rickets. What happens in the rickets? There is a prominence of the sternum. There is a undue prominence of the sternum. If you take the cross section of the rickets chest, there is a triangular shape. Chest is the triangular shape. Again, cylindrical shape chest. Epidiameter and transverse diameter both are same. Cylindrical shape. Or the barrel shaped chest. Also it is called as a barrel shaped chest. It is a in which condition? Emphysema. In emphysema there is a barrel shaped chest. Epidiameter and transverse diameter both are same. So these are the abnormal types. Also in the scoliosis. That last time also we see what is the scoliosis? S-shaped deformity of the spine. So this is also called as the asymmetry of the chest wall. Normally, chest wall is symmetrical. Transverse diameter is more than the epidiameter. In diseases like the pigeon chest, there is a prominence of the sternum. In emphysema, there is a barrel-shaped chest. Then, in scoliosis, there is an asymmetry of the chest. Also, there are many types of the chest: funnel-shaped chest, cobbler's chest. These are the abnormal types of the chest. Then next, we go to the movement of the chest. Next point is the movement of the chest. Observe the respiratory movements of the chest, inspiration and the expiration. So, movements of the chest. Subject or the patient is lying on the bed in front of you. You observe the respiratory movements. Inspiration, expiration. Inspiration, expiration. That is a bulging, inspiration, depression, that is the expiration. That is a rhythmical movement. These are the rhythmical movement. Observe the rate of the respiration. What is the normal rate of the respiration? 12 to 18 per minute. Normal rate, we found the rate for 1 minute and run for 5 minutes. It is a normally 12 to 18 per minute. Inspiration, expiration 1. Inspiration, expiration 2. Like this is count for the 1 minute. Normal is 12 to 18 per minute. And rhythm is regular. Rhythm is regular. That is inspiration, expiration. Inspiration, expiration. Rhythm is regular. That is a rate and depth of the respiration is the same. Rate and the depth. That is the between two cycles. Distance between the duration between the two cycles and the depth is the same. It is called as the rhythm is regular. Normally, rate is 12 to 18 per minute and rhythm is regular. In some lung diseases or the respiratory disease conditions, the rhythm becomes irregular. And rate may be increased or decreased. If there is an increase in the respiratory rate more than the 18, it is called as, what is the condition? Tachypnea. Respiratory rate increases. Fever. After exercise. Excitement. What happens? Respiratory rate increases. If you do exercise for the 10 minutes, jumping for the 10 minutes or running for the 10 minutes, what happens? Your respiratory rate will be increases. In fever, respiratory rate increases. So, increasing the rate is called as a tachypnea. Irregular rate, that is, rhythm is irregular. Suppose this is a normal rhythm. In some conditions, there is a regular, then there is a gap, then there is a 2 cycles, then there is a gap. It is called as an irregular rhythm. It is called as a irregular rhythm. Child strokes respiration. Child strokes respiration. In that condition, there is an irregular rhythm. First, there is a deep and fast respiration. Then there is a apnea. There is a fast and deep respiration, and then there is a decrease the rate or the reduce. It is called as a child strokes respiration. There are the irregular types of the respiration. Here, you count the rate for the 1 minute, write the rate, what you got for the 1 minute. Rhythm is a regular in the normal person. Then next is the type of the breathing. Third point is the type of the breathing. There are the two types of the breathing. In males is different and in females is different. In males it is a abdominal thoracic type of the breathing. In males it is a abdominal thoracic type of the breathing, and in females thoraco-abdominal type of the breathing. So which is your question or your subject? You write down which type of the breathing is there, thoraco-abdominal or the abdominal thorax. Next is the expansion of the chest. Examination of the respiratory system in lying down. If the patient can sit also in the sitting position. So expansion of the chest, ask the subject to sit, ask him to take deep respiration and see the expansion symmetrical on the both sides, anteriorly, posteriorly. Observe from the front side, there is a symmetrical expansion of the chest when he is taking deep inspiration, and also from the back side when he is taking deep inspiration. So expansion of the chest is a symmetrical, or one side is a moving and one side is a less moving. If suppose there is a pathology on the left side, there is a no full expansion on the left side. Right side is a normal expansion, but left side is a less or the reduced. So examine for the expansion of the chest from the anteriorly and also from the posteriorly, as the subject to sit and examine on the both sides. Then next is the accessory muscles of respiration are working or not. Again same, which we examine in the general examination. Accessory muscles, that's the sternocleidomastoid muscles. Patient is sitting in front of you or lying down in front of you. You observe the sternocleidomastoid, you know which is the sternocleidomastoid muscle, where it is. You observe the movement. If the sternocleidomastoid muscle is moving, that is, it is a working. Skeletal muscles, serratus anterior muscle, if they are moving, they are working. So see, the accessory muscles are working or not. If they are working, the patient is breathless. What it indicates? Patient or the subject is breathless. Then next is the position of the trachea. Position of the trachea, ask the subject to extend the neck and see the position of the trachea. Ask him to extend the neck to see the position of the trachea. Trachea is a centrally placed. It is a centrally placed. It is a cartilaginous tissue. Rings are there. You can see in thin and long neck person. You can see easily the position of the trachea. Normally, it is a centrally placed. This is the inspection. So only observe. The next is the position of the apex beat. Position of the apex beat same. Person or the subject is lying down on the table. Go to the foot side of the subject, bend and watch on the left side. Roughly in the left fifth intercostal space, if there is a pulsation, you can see the apex beat is a press. If you can't see right, apex beat is a offset. So here we finished the inspection of the respiratory system. Size and shape of the chest. Then movements of the chest, in movements of the chest, rate for the 1 minute, that is respiratory rate for the 1 minute, rhythm, regular or irregular, type of breathing, thoraco-abdominal or the abdominal thoracic, expansion of the chest, equal expansion or the unequal, that is symmetrical or asymmetrical expansion of the chest. Accessory muscles of the respiration are working or the not, position of the trachea, and last is the apex beat. Accessory muscles. Some people may not have the diurnal muscles are working or not. Position of the trachea. Normally, it is a centrally placed. As the subject extends the neck and observe the position of the trachea. And last is the apex. Examination of the apex. That is only observation, inspection. So these are the points under the inspection. Question for the inspection is examine respiratory system by inspection and report your finding. This question is for the 10 marks. Examine the respiratory system by inspection in given subject and report your finding for the 10 marks. So you have to cover all these points. Size, shape, movement, movement, right, count the rate for the 1 minute, rhythm, type of the breathing, expansion of the chest, accessory muscles working or the not, position of the trachea, examination of the apex. All points should be there for the 10 marks in the inspection of the respiratory system. Then next we will go for the palpation of the respiratory system. How many people are there? First, Manju, Aishwarya. Okay, next is the palpation. Palpation of the respiratory system. On palpation, there are the questions. Examine the trachea. Second, examine the chest movement. So, examine the trachea. In the inspection, if it comes, only inspect, there is no 10 marks. So, if the question is there, examine the trachea in given subject and report your finding. Examine by the inspection and the palpation. Both inspection and the palpation. First, in the palpation, first point is the size and shape. That is the symmetrical or the asymmetrical. First point for the palpation, size and shape. We have to confirm the findings of the inspection. In palpation, what we do? Confirm the findings of the inspection. So first point is the size and shape. Size and shape now you confirm that is the transverse diameter is more than the anteroposterior diameter. How to confirm it? For this, you have to measure the anteroposterior diameter and the transverse diameter with the help of these two cardboards. With the help of these two cardboards, you measure transverse diameter and the AP diameter. Suppose I am subject transverse diameter mark. Ask him to hold these cardboards in the axilla. This side, this side. Measure the distance. This is the transverse diameter. AP diameter, one is front upside and one is back side. This is the AP diameter. I will show you how to measure AP diameter and the transverse diameter. AP diameter, transverse diameter is again more than the AP diameter. Then the chest circumference. Chest circumference. Maximum expansion of the chest at the level of the hip. Maximum expansion of the chest is at the level of the hip. So, ask the subject to take deep inspiration and hold the respiration. Deep inspiration, hold and measure the circumference at the level of the hip. That is the during end of the inspiration. During end of the inspiration. Then ask him to expire or the expiration. And at the end of the expiration, again measure the circumference. That is the at the end of the inspiration and at the end of the expiration. So measure the epidiameter, transverse diameter, and the circumference. Then the movement of the chest. Also, we observe this in the inspection. Now you have to confirm here in the palpation. Movement of the chest. In movement, they are equally moving or not. Right and left side. Compare right side with the left side. Anteriorly, posterior, and at the apices. Anterior, posterior, and the apices. Before this, you should know the 9 areas of the respiratory system. There are the 9 areas where you have to examine the respiratory system for auscultation, for palpation, for percussion. So, which are the 9 areas? Supraclavicular, above the clavicle. Infraclavicular, supramammary, intramammary. Supraaxillary, intraaxillary. It is like how many days? 6. Then backside, suprascapular, infrascapular, intrascapular. I will show on the subject. 9 areas. If there is a question, auscultation of the respiratory system, we have to put the stethoscope in these 9 areas. Percussion, we percuss on these 9 areas. Supraclavicular, infraclavicular, supramammary, intramammary, supraaxillary, infraaxillary, suprascapular, infrascapular, intrascapular, in between the 2 scapula. These are the 9 areas. So, for the here, now the movement of the chest anteriorly, posteriorly, and at the apical levels. Ask the subject to sit. For the, suppose we have to examine for the movements on anterior front side. So, when you are examining, your hands should be, your fingers should be spread like this. Thumbs touch to each other. You put your hands like this on the chest of the subject for the anterior movement, on the chest of the subject, and ask him to take deep respiration. Deep but slow, not fast, not like this. Deep but slow. Ask him to take the deep inspiration. What happens? Because of the expansion of the lungs, your hands will be moved. Because of expansion of the lungs, your hands will be moved, and these thumbs are going apart from each other. These thumbs are going apart from each other. See, the thumbs are equally moving. Or one thumb is moving more and one thumb is moving less. That is the movement on the anterior or the anterior chest volume. So, anterior. Then go to the back side of the subject. Put your hands on the back side. Same. Ask him to take deep inspiration and observe the position of the thumbs. They are equally moving or not. Apical area. At the apices of the lungs. At the apices of the lungs, you put your hands on the shoulder of the subject. You are on the back side. You put your hands on the back of the subject. Again, thumbs are approximating. And ask him to take deep inspiration. What happens? Ask the subject to take the deep inspiration. What happens? Now here observe the movements of, not the movements of the thumbs, movements of the fingers, uplift of the fingers. There is an expansion of the apices of the lungs. Only the thumbs are moving, fingers are moving, not the thumbs. For the apical area, observe the movements of the fingers. There is a uplift of the fingers. This is the expansion of the lungs or the movement of the lungs equally on the right or the left, the equal or the unequal. Then palpation for the position of the trachea. In inspection, only you observe it is a centrally placed or it is displaced. It is shifting to the right side, shifting to the left side, or it is at the center. Only observe in the inspection. Now for the palpation, ask the subject, extend the neck and palpate the trachea from above down. Palpate the trachea from the above down. You will feel the cartilaginous rings. It is a centrally or not. This is one method, palpation of the trachea. Only palpate from the above down at the center. Second method, you put your 2 fingers, index finger and the middle finger, at the suprasternal notch. You put your these two fingers, index and the middle, in the suprasternal notch. What happens? You can easily put your fingers here. If there is a shifting of the trachea, what happens? You feel their resistance. You feel their resistance. Suppose there is a shifting of the trachea to the right side, what happens? You feel the resistance on the right side. Or there is a prominence of the sternocleidomastoides. There is a prominence of the sternocleidomastoid muscle because of the shifting of the trachea to that side. In conditions where there is a shifting of the trachea occurs, trachea opposite side, push opposite side. Suppose there is a pleural effusion on the right side, trachea will shift to the left side. There is a pleural effusion on the right, trachea will shift away from that condition. That is on the left side, pleural effusion, pneumothorax. Pull towards, on the pathological state, pull towards in the fibrosis or collapse. Fibrosis of the lung or the collapse of the lungs, trachea pull towards. Shift away in the pneumothorax and the pleural effusion. Otherwise, it is normally placed at the center. If there is a shifting of the trachea is present, it is called as a trail sign. It is called as the trail sign. Trail sign positive. Shifting of the trachea. In conditions like the pleural effusion, pneumothorax, fibrosis of the lungs, collapse of the lungs. These are the conditions. This is the examination of the trachea position. Central, deviated to the right or deviated to the left. Position of the apex bit. You know how to palpate the apex bit? Cardiovascular system. Palpate the apex bit and measure the distance from the midclavicular line and write your finding there. Position of the apex bit on the left hip intercostal space, 1.2 centimeter, medial to the midclavicular line. Pulse respiration ratio. Pulse respiration ratio. For the pulse respiration ratio, count the pulse rate for the 1 minute. What is the normal pulse rate? 60 to 90 beats per minute. Always take your answers in the range. 60 to 90 beats per minute. If less than 60 beats, it is called as a bradycardia. More than 90 beats, it is called as a tachycardia. So, count your pulse rate for the 1 minute, count respiratory rate for the 1 minute, and pulse respiration ratio. Pulse respiration ratio. That is the next point, size and shape, then movement of the chest. Third point is the position of the trachea, an examination of the position of apex. Remember this place sign for the examination of the trachea. Position of apex bit. Last is the pulse respiration ratio. Normally it is 4 to 1. Normally, how much it is? 4 to 1. Normal pulse rate 72, respiratory 80. So it is a 4 to 1. Pulse respiration ratio. Most important point in the palpation, tactile vocal femidus. TVF, tactile vocal femidus. Again for the 10 marks. Examine the given subject for tactile vocal femidus. That is the TVF. 10 marks. What is tactile? Tactile means what? In these three words, the meaning of this tactile means touch. Okay, correct. Vocal sound. Tremulous. Tremulous means what is tremulous? Vibrations. Vibrations. So what is the meaning of these three? Tactile, vocal, tremulous. Touch, sound, vibration. Touch, sound, vibration. So what is the tactile, vocal, tremulous? This test is done by giving instruction to the subject to say the words with the nasal brand. To say the words with the nasal brand like 99, 11. These are the words 99, 11 continuously with the same pitch. Pitch should be constant throughout the exam. Ask him to say these words with the nasal brand. And you have to put your right ulnar border. You have to put your right ulnar border in the intercostal space. In the intercostal space. This is a comparative test. Right side compared to the left side. Right lung function compared to the left lung function. So this is a comparative test examining with the right ulnar border. Touch, tactile. You are touching or you are palpating with the right ulnar border. Instructions: ask the subject to say the words with the nasal brand 99 or the 11. At that time, you are palpating the sounds, vibrations of the chest wall. So, what is this? To touch or palpate the vibrations which are created on the chest wall because of phonation from the lungs. Sorry, larynx, where the sound is produced here in the larynx, and this sound is transferred from the larynx, trachea, bronchi to the chest wall, and you are feeling is palpating these sounds over the chest wall. So tactile, vocal, tremulous. Patient is lying down or in the sitting position. Ask him to say the word 11 or the 99 and put your right ulnar border in the intercostal spaces. Same simultaneously on the both sides. Right, left, right, left, right, left. Anterior area. When you are examining in the sitting position for the anterior area, subject should be sit erect. Subject should be sit erect. When you are examining for the back side, he should cross his hands on the shoulders. Maximum area to be exposed on the posterior. So ask him to put or cross his hands on the shoulders and examining from the posterior or the back side. When you are examining for the axillary area, ask him to put his hands on the head. Ask him to put his hands on the head and examine for the axillary area. Same, right, left, simultaneously both sides. In exam, students make mistake. They are examining the right side one time, then left side second time. No, don't do like this. This is a comparative test. So right, left, anteriorly, same posteriorly, and then for the axillary. So this is the tactile, vocal, tremulous. What it indicates? What it indicates? KVF increases in conditions like the consolidation of the lung. In lung consolidation, the sounds will be increased. Tactile, vocal, tremulous. Not sound, this is the palpation, vibration which means they are increased in the conditions like the lung consolidation. Then decrease in the pleural effusion and the lung collapse. Decrease pleural effusion and in lung collapse. Tactile, vocal, tremulous. Then go for the percussion. Which is a normal note on the lungs or the respiratory area? Percussion, tapping. Which type of the normal note you heard on the resonance? So, percuss all over the lungs. You will got there resonant note. You should know where there is a note should change on the left side because of the presence of the heart. Stomach, spleen, right side because of the upper border of the liver. So percussion on the anteriorly, again anteriorly, posteriorly, and on the back side. At the three areas you have to percuss. Normal note is the resonant note. You can see the lower border. When you are percussing, lower border of the lungs, you can percuss. Examine the lower border of the lungs. At the mammary line, it is in the sixth rib. Or the other sixth rib at the mammary line, eighth rib, axillary line, and 10th rib and posteriorly scapular line. 10th rib, scapular, lower border of the lung, lower border of the lung. Mammary, 6th rib, scapular, axillary, 8th rib, posteriorly, and the scapular, 10th rib. Lower lung border. During percussion, these are the that is the 6th rib, 8th rib, and the 10th rib. Mammary line, axillary line, and the scapular line. Then auscultation. Auscultation first for the normal breath sounds. Auscultate all over the 9 areas of the chest. Put the stethoscope, supraclavicular area, infraclavicular area, supramammary, inframammary, at the axillary area, and on the back side. Suprascapular, infrascapular, and the interscapular. Auscultation for the normal breath sounds. There are 2 types of the normal breath sounds are there. Auscultation. 2 types. One is the vesicular sound and second one is the bronchial sound. Normal respiratory sounds. Vesicular sound and the bronchial sound. Vesicular and bronchial. What is the characteristics of the vesicular sound and the bronchial sound? Vesicular sound is like the rustling of the leaves. Vesicular sound first like the rustling of the leaves, and it heard all over the lung. If you put the stethoscope all over the lung, you can hear the vesicular sound. It is a like rustling of the leaves all over the lungs. Then bronchial sound is on the hollow tubular structures, where there are the hollow tubular structures present on the respiratory system. Bronchial sound will be heard there. And is the like air is moving through the pipe, like the air is moving through the pipe. So where the bronchial sound will be heard? On the trachea, main bronchi, right and left bronchi. Trachea, main bronchi, and right and left bronchus. On only that area you will hear the bronchial sound. Vesicular sound is like the rustling of the leaves. Inspiratory phase is longer, expiratory phase is shorter. For the vesicular, inspiration or the inspiratory phase is more longer as compared to the expiratory phase. For the bronchial sound, inspiratory phase and expiratory phase both are same, and there is a gap between the inspiration and expiration. It is continuous. There is no gap. But for the bronchial sound, there is a gap between the inspiratory phase and the expiratory phase. and duration is the same, inspiration and the expiration. So this is the vesicular sound and bronchial sound. Vesicular all over the lung, bronchial only on the trachea, bronchi and the right and left bronchus. Then first you put the step over the chest and examine for the air entry equal on the both sides is present or not. On this is side, air entry is reduced. So compare right side to the left side. Examine for the air entry equal or unequal. Second type of the breathing on chest, which type of the breathing? On the trachea, bronchus, which type of the breathing? Then next is the any abnormal sounds present or absent. Any abnormal sound. Abnormal sounds like the dry sounds or the crackling sounds in tuberculosis or in the pleural effusion. Crepitation, it is also called as the ronca. That is it is also called as the ronca. It is the dry sounds or it is also crepitations. These are the abnormal sounds, ronca or the crepitation. Only for abnormal sounds are present or the absent, and which are the abnormal sounds, that is the ronca and the crepitations. Bronchial asthma. Suppose patient is breathless, you can from without ausculting you can hear the sound. Patient is taking how he is taking respiration or what type of the sound is there in the patient of the asthma. Then next is the vocal resonance. Last is the vocal resonance. So what is the vocal resonance? This is again the auscultation. Like the tactile vocal tremulous, same like the tactile vocal tremulous, but tactile vocal tremulous is the palpatory test and vocal resonance is the auscultatory test. Tactile vocal tremulous is a palpatory. You are feeling the vibrations with the head of the right hand ulnar body. Here vocal resonance, auscultation, auscultatory test. Same as the subject to say the words 9 or the 1 and you auscultate over all the 9 areas of the respiratory system. You auscultate, and again this is a comparative. So right, left. This is the vocal resonance. Auscultatory test. Again, vocal resonance. In which condition it is increases and in which condition it is a decreases. Vocal resonance is increases in the lung, where the lung conductivity is increased. Vocal resonance is increased like the this consolidation of the lungs and decrease in the pleural effusion. TVF is also increases in the lung consolidation and decreases in the pleural effusion. Vocal resonance increases in the lung consolidation and decreases in the pleural effusion. So here we finish the respiratory system. How to write the journal? Page number 85. Write the name of your subject, age, sex, general examination, body build, coverage, nourishment, normal, cyanosis, present, absent, clubbing, present or absent, neck veins, distended or not distended, accessory muscles of respiration, working, not working, lymph nodes, enlarged or not enlarged. For inspection, size and shape, symmetrical or asymmetrical, movement of the chest, respiratory rate per minute, count and write down your finding, rhythm, regular or irregular, type of breathing, in males it is abdominal thoracic, in females it is a thoracic abdominal. Expansion of the chest, equal or unequal on both sides, anteriorly, posteriorly. Accessory muscles of respiration, working, not working. Position of the trachea, central, deviated to the right or deviated to the left. Position of the apex beat. Left fifth intercostal space, medial to the mid-clavicular line, 1.2 centimeter. Palpation, confirm the findings of the inspection. Epidiameter, measure with the help of the two cardboards and the measuring tape, and right. Transverse diameter, chest circumference at the end of the deep inspiration, at the end of the deep expiration. Movement of the chest wall, equal or unequal, right, left, in apices, anteriorly, posteriorly. Position of the trachea, centrally placed, palpate. Centrally placed, deviated to the right or deviated to the left. Palpation of the apex beat. Pulse respiration ratio. Count respiratory rate, count pulse rate, and derive the ratio. Tactile vocal femidus, equal or unequal on both sides, anteriorly, posteriorly, and in axilla. Percussion, resonant node for right, left, anteriorly, posteriorly, and axilla. Auscultation, air entry on the right and left, equal or unequal, anteriorly, posteriorly, and axilla. Type of the breathing. On the chest, which type of the breathing now? On the chest, all over the lung, which type of the breathing? Vesicular. On the trachea and interscapular region, bronchial. Any other abnormal sounds heard or not heard? That is a bronchi or the crepitations. That is a crackling sound, or the air is moving through the narrow pipe like this. You can hear, will be right there, heard or the not heard. Vocal resonance, like the tactile upper premises, auscultatory test, equal or unequal, right, left, anteriorly, posteriorly, and at the axilla. Here, respiratory system examination is finished. For the percussion, examine respiratory system by percussion method and given subject and report your finding. 10 marks. Percussion. Then examine chest movements. 10 marks. That is palpation. Examine respiratory system by auscultation and report your finding. Examine vocal resonance in given subject and report your finding. 10 marks. Each question is for the 10 marks. So all systemic examination, inspection, palpation, percussion, and auscultation. All four systems there is a this 10 marks question is there. And examine the trachea by inspection and the palpation. Again, this is 10 marks. Trace sign. If there is a shifting of the trachea, trace sign is a positive. I will demonstrate you how to examine the respiratory system. Can you call the attendance? Open the and tell you one pointer, like last time.